So there's something I've discovered lately that's casual interaction with some patients as a way of making them to relax and then open up more about their problems. And that helps a lot. And that makes it easier for you to know how to help them better. Okay, during my last weekend duty, there's this particular one that came around. And shortly after we got talking, everything was going so smooth and gentle until she suddenly declared, I don't tire. I don't tire. You know the kind of hopelessness that one feels when she has done everything that she thinks is the right thing to do and she's still not getting the right results. That's exactly what she felt. According to her, she's been dealing with urinary tract infection for years now. And each time she goes for treatment, everything calms down. And then just when she starts feeling like everything is all right, the symptoms start popping up just gradually, little by little. And before you know it, everything comes down to the way it was before. She's been blaming everybody, she's been blaming everything except herself. So you see, when things like this happen, it's easier for someone to start blaming everything else. But nobody is talking about taking some preventive measures in the first place to prevent that from happening. The truth remains that even after a successful treatment, if you go for one, and you get exposed to the same thing that caused it in the first place, you will eventually and definitely get it for another round of time. And so what I think it's good we sit back today and look at all the things we can do and the things we should avoid to prevent ourselves from getting urinary tract infection. So this is a video you should pay attention to. And please, if you're new to this channel, please do well to tap that subscription button so that you get onto this moving train. It's a winning train and we're going to be winning against many things, including urinary tract infections. But then, why would you even pay attention to this video? I mean, there are a lot of drugs out there that can cure you in a situation whereby you get infected. There are a lot of drugs, there are a lot of antibiotics, there are alternative medications, there are herbal mixtures, some of which promise 100% cure for urinary tract infection. So you could walk into any chemist shop, any pharmaceutical outlet and get one for yourself if you need that. But then, have you sat down to calculate the cost of all these things? Ideally, you're supposed to go for laboratory screening, medical examinations to find out if you actually have urinary tract infection. But let's just assume you are going to skip that, which is not advised anyway. Have you thought about the costs? Have you thought about the amount you're going to spend buying all these medications? And let's assume you get them. Do you know that the discomfort and pain that comes with urinary tract infection is something that will also affect you? Oh, you've not thought about that. Think about it this way. The drugs you are using can also fail in some cases because you did not go for the right diagnosis and you started treating. That's just like self-medication. Have you also thought about the subsequent adverse effect that can come from these drugs when you start using them? And finally, have you thought about a possibility of antibiotic resistance that can start developing when you do such a thing? So with all these things mentioned, I think it's far better to go for prevention than waiting to get infected and still go for treatment. So what are the things you need to do? First of all, take enough water. As common as that sounds, is very powerful. And this is what I mentioned to a friend. I said, ordinary water. Yes, ordinary water. It's very important. Now, why am I saying this? Because each time you drink more water, your urine production increases. I remember that in one of our previous videos, we said that each time you begin to take more water, your body begins to produce more amounts of urine, which will make you to go and pee. So it means as you're taking more water, you have a higher chances of peeing more than usual. And this helps to wash away all these infectious agents even before they have all the time to multiply, attach themselves at strategic position to cause you harm. You think about that. And so it's very important you take enough water. But then there are some discomfort that can come in, and that's actually valid. Some people may argue that it's not convenient to carry water all around, especially those ones who can afford to be buying water all along the way. But then there are water cans you can use like this and this. They can help you to carry water in some cases that you will be outside your house for a given period of time. And then also there's this discomfort of rushing to the restroom to pee, especially when the urine gathers. But then there's a way you can do that. Instead of taking a 1 liter of water at a time, you can just split it into bits and sip it at intervals. So that will help you to spread it out. And unless you are having any medical conditions like kidney problem or heart problem or some other medical conditions that can limit water intake, it's advised that you take at least 2 liters of water on a daily basis. If you make this a daily habit, this will help you so very much. And then on some other days or days that you are engaged in some strenuous physical activity that will make you lose more water through sweating and then reduce the amount of urine you produce, this amount can be increased. It's advised you take more water, more than 2 liters. And when this urine starts coming out because they are being produced, do not hesitate to go and empty your bladder. You see, holding urine back gives all these infectious agents all the time to multiply and position themselves where they can cause more trouble. This is actually a war that we have to be very intentional to win. There are some cases that you may have some restrictions due to your work, personal reasons, or environmental factors limiting you from going to pee immediately. But what we are saying is that whenever possible, do not hesitate to go and urinate when you feel the urge. And when you are at it, please make sure you empty your bladder completely. Do not hold anything back. It's very important. And for those who are sexually active, however tired you may be after the act, please do not hesitate to go and urinate, because this will help to flush out all these infectious agents that might have gotten during the process. If you make this a daily habit, you will stay away from urinary tract infection to a greater extent. And another thing you should make a daily habit is proper personal hygiene. That's very important. In fact, there's no better way to say this. You can't get it wrong by keeping yourself clean at all the time. And as regards urinary tract infection, you have to wash your genital area every time with clean water. It's very important. And for females, please avoid douching. All those harsh feminine products you use on your body in terms of cleaning, please, they are going to scatter the microbial balance that is supposed to protect you. They are going to kill the good bacteria that is meant to protect you. And when this happens, it will give chance for the bad one to come in. Use clean toilet. Do not say you did not hear this one. Use clean toilets. And then make sure your underwears are clean and made of breathable fabrics like cotton to enhance ventilation. Please, it's very important. And while you are at this thing, please ensure you add balanced diet to the mix, because this will help to boost your immune system and help your body to fight better against this bacteria we are talking about. By the way, that reminds me, have you heard of cranberry juice? A lot of studies have confirmed that this can help to reduce your chances of contracting urinary tract infection. Just check it out. In fact, many clinical reviews have confirmed that this contains a chemical called proanthocyanidins, which dislodges some bacteria called Escherichia coli. And when these bacteria are dislodged, they don't have all the time and strength to attach themselves and do all their business. And so while urinating, everything is washed out. Have you seen how amazing that is? Other food classes that you shouldn't joke with include fruits and vegetables. Very important. Grapefruit, oranges, strawberries, lemon, and things like that. Ensure you eat whole grains. Make it a daily habit to add lean proteins and healthy fats to your diet, because this will help to boost your immune system. And finally, use antibiotics responsibly. You see, just like we mentioned before, it's very easy these days for anybody to walk into any pharmaceutical outlets or any chemist shop to get all these antibiotics without being prescribed by a medical professional. That is doing your body some harms that may far outweigh all the temporary benefits you are going to get at the end of the day. So as much as possible, avoid self-medication. And do not share antibiotics. That your friend or your partner is taking it doesn't mean you should take it too, unless it's prescribed for you too. Do not take antibiotics until medical diagnosis is fully carried out. That's very important. When you begin to take antibiotics without prescription, it has a way of killing everything outside. It's just like trying to kill your enemy in the market. You may end up killing somebody that is innocent. And then when you damage this good bacteria colony that is supposed to protect you, it gives chance for the bad ones to come in and occupy all the spaces, making you prone to infectious diseases, including urinary tract infection. So what we are saying in essence is that preventing yourself from getting urinary tract infection doesn't require you breaking the banks or some complicated routines. No, it's not like that. It just involves some little habits that you can afford to keep. Things like taking adequate water, not holding urine back, keeping yourself properly clean, maintaining proper personal hygiene, ensuring that your diet is balanced, and not taking antibiotics without prescription. That's very simple and very easy to keep. And remember, prevention is still better than cure. And in case you have any other way that have worked for you, preventing or staying away from urinary tract infection, please do not hesitate to let us know so that we all can learn together. Our next video is going to focus on the best urine sample to collect when you are going for urinary tract infection testing. So ensure you don't miss it for anything because it's going to be very hot. And make sure you share this video so that more persons can see it and learn too. Thank you so much for watching. I hope to see you in the next.